Hello, my name's Ed Hope, a junior doctor from the UK, and today I have a challenge. I'm going to be watching Chicago Med and trying to guess the diagnosis.
Memory loss, phonemic paraphasia, substituting pen for pen, that kind of thing. You might also experience sleep issues, hypersomnia, impulsivity, disinhibition, irritability.
Sounds great, huh?
So these kind of symptoms are all to do with problems with the brain. So they're talking about paraphasia. So phasia is to do with speech, and para means something next to, like parallel. So paraphasia is when we try and say a word, but we accidentally say the wrong word. So, for example, we may say foxes are nautical instead of nocturnal. It's also describing hypersomnia. You probably know what somnia is, to do with sleep. So hypersomnia would be extremely sleepy. So quite what's going on. Maybe the patient's starting some new medications, so this may be causing the symptoms, or they may be having some kind of procedure on the brain.
White count is 16,000 with left shift plus bicarbs are up.
Okay, so the white cell count is elevated. So the white cells are the cells in your blood to do with the immune system. So when they become elevated, that means your body is fighting an infection. The left shift means that the cells are very immature, they're very young, they've been recently produced. That means there's an infection going on, and it's a recent infection, so your body's increasing lots more cells.
Intracranial pressure is way up.
Henry 5 of morphine.
BP spiking.
Heart rate's down to 42.
Cushing's response.
Give another 70 of mannitol.
Will, his pupils are blown.
It's supposed to be, you know the old phrase, it's not brain surgery. That's what we're dealing with here, basically. They mention Cushing's reflex. This is a bad sign. The patient's obviously had a trauma to the head, so a brain injury. Whenever we get injury, we get swelling. This is increasing the pressure inside the head. This is a very bad sign that they're getting it this severe, and it probably means the patient has irreversible brain damage and may even die.
So you had some pain when I palpated your abdomen, so I'd like you to get a CT and a CBC with white count.
So patients come in with abdominal pain, really common symptom actually, of which there are multiple possible diagnoses. If the patient was slightly younger, I'd go for something like an appendicitis, so an infection of the appendix. Or if the patient was slightly older, I'd worry about something like diverticulitis. Again, this is kind of an outpouching of the bowel that can get infected. So there you have it. I've done my best to try and diagnose everyone from these episodes of Chicago Med. It's a lot of fun. I hope you guys enjoyed finding a little bit more out about medicine.